Morning, Logan.
Morning.
How are you?
Good. How are you?
I'm good.
That's good.
Did you have a good weekend?
Yeah. Did you have a good weekend?
Yeah, for the most part, I think so.
That's good.
Did you do anything fun?
I just babysat.
Oh, did you? For a sibling or cousin?
Cousin.
Ah, boy or girl?
2 boys.
Oh, wow. Were they pretty active? What ages are they?
One is 5, one is 10.
Oh, wow. Quite
And
an age
then-
difference.
yeah.
Is it hard to babysit them because one wants to do this and the other one wants to do that?
No, the 10-year-old is usually just playing the Xbox,
Oh,
and the 5-year-old is the only one I really have to chase around.
right, yeah. Dang. Well, good for you.
Yeah.
Hi, everybody. How is everybody
Hi.
doing?
Morning,
Hi,
Lisa.
Tanner.
Tired.
How are you guys? Tired?
Hi.
Yeah.
Yeah.
So, anything new? How's the new 9 weeks going for everybody? Better than the first?
It's been going good. Yeah.
Good. Fantastic. All right. Well, as always, I'll just wait for everyone to come in. Let's wait another minute, but we're going to start on that warm up this week for the and we'll turn those in on for you guys it'll be Wednesday for this week. So just remember that.
Hey, Ms. Upka.
Yeah.
So you remember how much coffee you would be seeing me drink in our old class?
Yeah.
Happy to say I've cut that back. I started drinking a little bit of tea here and there.
That's good. Good.
Yeah, cutting my addiction.
I probably wouldn't even be able to have it because too many fingers are in it. So I would probably have to ban it from school if we were back. But
I'm sorry, what did you just say too many fingers in it?
yeah, like, too many people touching the coffee maker and the coffee and spreading germs and all that.
Oh, for a second there, I thought you were saying that people were putting their hands in their coffee. I was like, what?
Stirring it up, stirring it up.
I mean, I can feel like a 5-year-old or something. Like you got your cup on the floor and they come up and they put their hands in it, but like,
yeah, exactly. Oh,
yeah,
my
I used to do some babysitting myself, so I understand that.
That's funny. It would probably be quite painful if they put their fingers in the coffee.
Hey, you never know.
That's right. This is true. Good points. All right. Well, I say let's go ahead and get started. So we're gonna start with that warm up. All right, here we go. I'm gonna turn my camera off as always because it always takes forever to get it to load. So hopefully by doing that, I'll get it going a little faster here. Okay, so since we were talking about female anatomy last week, your question today is, if I can hit on the right one, what is another name for the birth canal? So if you're going to do it correctly and in a complete sentence, you would say another name for the birth canal is, and then end it with a period and start it with a capital. So here we go in 3, 2, 1, start. You have 27 seconds. Try to finish up. And if you could pull out the copy of the reproductive system, that would be great. And we're going to go over some of the terms. So I'm going to need you to unmic when I ask a question. So, all right. So your warm-up should be done. Like I said, we'll turn those in on Wednesday. If you guys could help me remember that. I get kind of discombobulated sometimes. But you'll turn those in. Remember, I don't take any late points on those. They're due whenever you get them to me, and you'll get full points just on the warm-ups though. But remember, in this new 9 weeks, we are reducing late work to 80%, and then after the unit test, it will be worth 0. Okay, so just keep that in mind. All right. I don't believe we really had anything due last week. We just did the female anatomy. We took a test on Monday. So we're kind of in the middle of taking notes and learning about the female anatomy. Just as a good recap, it was shown to me by giving the pretest that there's 2 sides of the spectrum. You either know a lot or you don't know much. So I'm going to try to fill in the blank there to hopefully get everyone to at least know a good portion about the anatomies that they have, or one that they might have to learn about, being a father to a daughter or mother to a son or something like that. Okay, so let's just recap. I'm showing you the diagram at this point in time, and I'm not going to ask you where things are, but I am going to define them and ask that you tell me what I'm talking about. So this is a woman has 2. They produce ova or eggs. And a woman is born with all the eggs she will ever have. So what organ am I talking about? You can be anybody that wants to unmic to answer. If you could, that would be great. What is that called? Women have 2. It's where ova and eggs develop, reside.
Is it the
Yes,
ovaries?
very good. Thank you. Okay, this is a tube where the egg travels along. It's where fertilization takes place. A woman has two. What is it called? Passageway for the egg cell travels down. That's where.
Fallopian
Yes,
tubes?
very good. Thank you. This is where the baby resides for 9 months, 40 weeks. Also has a lining that gets shed once a month. What is it? Anybody? Baby's housed there. Also has an endometrial lining that sheds once a month.
Uterus?
Yes, thank you. This is the end of the uterus or opening into the vagina. It gets to be 10 centimeters for a baby to be pushed out safely. What's that?
The cervix.
Yep, very good. This is another name for birth canal. What was that? Another name for birth canal? I think I missed it. Anybody? It was
Vagina.
Yes, very good. Thank you. This is where urine is stored. I don't know if we talked about this one, but where would urine be stored in your body?
Uterus.
Nope. The bladder. The bladder is going to hold the urine. And then what tube does urine come out of? It would be identify number 5. What would urine come out of?
Uterus.
Yes, very good. Thank you. Okay. I want to make sure, or sorry, not uterus. What am I saying? Urethra. Urethra. So
Urethra.
number 5 is urethra, and then this one is number 4, bladder. And we talked about last week why the female has to go to the bathroom so much when she's pregnant, because the urethra, or sorry, the uterus, good God, I'm starting it. The uterus sits on the bladder, making it smaller and smushing it. Okay, so one quick kick from the baby could send a female to the bathroom quite quickly. Okay, sorry, didn't mean to screw those up, but urethra is connected to the bladder and the uterus is connected to the vagina. Okay, so that means that females have 3 exits. We have the rectum, the vagina, and the urethra. That is why when a female has a menstrual cycle, the tampon goes in the vagina and she can still use the bathroom. Okay, just clearing that up because that was one issue that a student I had that issue. Didn't understand the difference. Okay. All right. So let's ask some questions of you before we look at that slide presentation again. But what words are used to describe a menstrual cycle? Like what is it called, or what is the slang that some people would say about it? What's it called? Anybody want to venture into that realm? Another name for a menstrual cycle? Do you at home you say menstrual cycle? Because I'm pretty sure you don't. You can put it in the chat. Oh, a period. Okay, thank you, Miss Brave Soul. Okay. You can put it in the chat because I've kind of switched over. So if that's safer for you to comment, that's perfectly fine. So I would say period would probably be the number 1 that it's called. Some people, this is kind of old, but they call it their monthly bill. Any other slangs that are out there that you can think of? That's the only thing that comes to mind for me. What do you think? Monthly leaking, okay. All right. So what do you think the significance is from society to females when they start their first period? What is the significance behind that, do you think? Okay, so yeah, like you're a woman now. You can have a child. Good. Yep, that's what I was thinking too, Kyla. So that's kind of the message that society gives females about their menstrual cycle. And so I'm going to talk about that. And so hopefully I can pull this up and we can view it. Let me know if you can't see it. So this is what we went over last time we were together, is all the anatomy of the female. I am going to do a Quizlet eventually that has all this on there so that you can kind of practice it before I give you I'm going to call it a kind of a quiz. So just keep that in mind. That'll probably be next week sometime. Just a quick quiz over this. It's not going to cause us to leave class. It's not going to be like an overall test that we would leave class for, but just like a quick little quiz over what you learned over the anatomy. Okay. All right. So moving on to menstruation. So once a female matures, her uterus prepares for a pregnancy each month. Okay. So I know when I was your age, and even still, a period is something that I'm going to just speak for myself. I'm not overly excited that it has appeared. Okay. And I am sure that I'm not alone in this. So, but remember, that's how you can reproduce. So if you never had a period in your whole life, your body would not be prepared to house a pregnancy, and the eggs would not be being released because there's not enough hormones to do that. So even though some people look at a menstrual cycle or period as a burden, there are some good things that come out of it. So, if you don't want to have kids or whatever, that's unfortunate because, that's what the menstrual cycle is all about. But if you want to have kids someday, you kind of have a little trade-off. The trade-off is that when you are pregnant, you don't have a period for that whole time that you're pregnant. And if you choose to breastfeed, that can even increase the probability that you're not going to have a period for a few months while you're breastfeeding, but eventually it'll come back. So just keep that in mind. Basically, it is the lining of the uterus that builds up each month called the endometrium. And then if an egg does not get fertilized by sperm, it'll travel down into the uterus. It will kind of dissipate into the endometrial lining, and then that will be expelled out of our bodies, female bodies, through blood. Okay. It passes through the cervix, out the vagina. You'll need to use feminine hygiene products to absorb the blood. There's different things out there. I mean, there's the sanitary napkins or pads. There's tampons. There's a Diva cup. So these are some options that are available to females to help with that realm. You got to be careful with tampons because of toxic shock syndrome. If you leave them in too long, they can develop bacteria, and that can cause a whole slew of problems. And the severity of it is that it could cause death. Okay, so you only want to leave those in for the recommended amount of time, 4 to 6 hours, and then you need to, take them out and then put a fresh tampon in if that's what you're using, and that's what would cause the toxic shock syndrome. And I'm just going to go back and forth from the chat to the PowerPoint. So if you do have a question, you can pop it in there and I'll try to keep an eye on that. So if you don't want to ask outwardly, you could always ask there. Okay. And I'll just kind of keep monitoring that. Okay. So everyone has their own cycle. Basically, a cycle is from bleeding to bleeding. And day 1 of the cycle is the first day of bleeding, okay, or the shedding. 9 to 13, hormones will cause an egg to mature in one of the ovaries. That is going to then on the 14th day cause ovulation, and that it means that there's an egg there that can be fertilized and can develop into a baby. And like I said, the 15-28, the egg travels through the fallopian tube of the uterus. If the egg is not fertilized, the cycle starts again, okay? Everybody's cycle is different. A typical cycle, you could have a 21-day cycle, a 24-day cycle, a 36-day cycle. It's just a consistent cycle is what has been your cycle for you, Okay. So, if it comes every 21 days, that's your cycle. Sometimes they, are irregular, and that does happen. It could be a hormone issue, but a lot of times it just takes several years for your body to kind of regulate things, and they will last anywhere from 2 to 7 days, depending again on how your cycle is. And I told you last time that you can kind of look at your mom and maybe ask her questions about the cycle, because that will maybe depict or determine how your cycle is. Okay. And that can, be important to know if that's something that is important to you. Menopause is when your body starts producing hormones, and when you don't have the hormones and you're not releasing eggs, and your body doesn't need to build up the lining each month. And so females will go through menopause usually around, like, I'd say maybe late 40s, early 50s. Everybody's different. But once that process begins, pregnancy becomes less and less likely, okay, because there's no egg that's needing that lining to build up. Females also have what's called cervical mucus throughout the month or throughout the menstrual cycle. It's basically a thick white mucus that's produced from the cervix, and it begins several days after bleeding stops. It is also happens near ovulation. So when that clear mucus is present, then ovulation probably has begun. That mucus is also there because it's sperm friendly, and the vagina is really like an acidic environment. And so when a woman ovulates and there's this clear mucus that's available for the sperm, it can travel a lot easier through the vagina and up through the cervix. So some people, I feel like I've said this before, but some people feel that women can get pregnant every single day of the month, and that is not true. They can only get pregnant when they are ovulating. Okay. So if sexual intercourse took place on a day when the female is not ovulating, there is no pregnancy that would occur. Okay. When you're ovulating, you have a high probability of becoming pregnant. Doesn't always work for some people. Some people have fertility problems. And so that could be a reason why pregnancy is not occurring when ovulation is taking place. And there's a lot of things that can be done to figure out, how to correct the problem or what the problem is altogether. But a female can only get pregnant when she's ovulating. And so the best way I can describe it to you about ovulation is if you start counting the day of your menstrual cycle, the very first day, and you count through your cycle until you start bleeding again, okay, you will count your cycle backwards. So when you start bleeding again, you would count 14 days backwards, and on the 14th day is when you are ovulating. Okay. Now that is not set in stone. Everybody's different. Just because I'm telling you that this is typically when you're ovulating does not necessarily mean that it's ovulation for you. It does alter depending on what kind of cycle you're on, but typically it is the 14th day, if you count backwards, when you would be releasing an egg for ovulation. All right, let me just click back and make sure there's no questions. Okay. All right. So hopefully that makes sense to you. Let me make sure I said everything that I wanted to say about that.
I have a question.
Yeah, go ahead.
So you know how like birth control, the pills make it so you have like different cycles depending on what kind you're on. So
right. It's a hormone, so they're releasing hormones when you take that pill.
yeah. So what, like, how many days is the one where there's only the 4 sugar pills? Because I know that's not like a regular one.
You're asking me about birth control that has 4 pills?
Oh, I was asking you about the cycle thingy.
Oh, you mean for ovulation or for your period?
I don't know. You're talking about the whole cycle
Right. So if you
and
were,
how it's different days and stuff.
yes. So if you were on the pill, then you would not have to worry because your body's not going to produce the egg, or it's going to thicken up the cervical mucus so sperm isn't going to be able to get through. Does that make sense?
Yeah.
Okay. And then so if you're on the pill and you take it regularly, then you shouldn't have to worry about pregnancy. But if you take it irregularly, like you forget all the time, then that can be an issue because it's putting holes within your protection. But if you're on the pill, you should be protected from pregnancy. However, remember that you still can get any type of STD because the pill is for pregnancy only. So hopefully that answered your question. So, and sometimes too, when you're on the pill, your periods are almost predictable because the pill really regulates things for you. So you pretty much know the day that your period is going to happen because the pill regulates things for you.
That's
And
why
yeah,
I said the 4 white pills, because
and
that,
then,
like, I was trying to
right,
figure out if that's
yes.
like has anything to do with the days.
Okay, I get your question now. Basically, those sugar pills are there so that you stay on a cycle. So there are actually pills, birth control pills that don't provide the sugar pills. And the bad thing or the drawback from that is you have to remember in 7 days that you have to start a new pill pack. But if you have those sugar pills, and they keep you on a schedule so that when the sugar pills are gone, you know you got to go get another pill pack. That's what that's about. But it has nothing to do with lessening your protection when you take those. You are fully protected. They are just trying to keep you on a cycle so that you don't get off of it. So I think I might have cleared up your question now that I understand what you were asking me.
Yeah.
So sorry. Sometimes,
It's
you know,
okay.
it's like hitting my head against the wall. What is she trying to tell me? Ah, okay. So I'm glad I cleared that up for you. So don't worry about that. Those sugar pills are there only for you to keep on a regular cycle. Okay. Oh, you know what? I wanted to talk a little bit more about a couple things, and I'm glad that when you asked that question. Give me like 2 seconds. I gotta let my dog in 1 sec. There's a couple things that I wanted to just mention just in case there was any issues. Irregular menstrual cycles, like I said, can be irregular because of hormone imbalances possibly. So if you really have some irregular menstrual cycles, like they're coming too often or the blood flow is so heavy, there are doctors out there that can, listen to what you're going through and might have an alternative for you as far as an option that's available. So just remember that. And then, where was that I wanted to talk about? Over here. Okay, so other things that can affect your menstrual cycle too are like poor nutrition habits, illness sometimes, stress, sexually transmitted infections can also affect that. You can also have dysmenorrhea, which is painful periods, normal versus abnormal. Normal cramping often includes pain or cramping during bleeding. A person's ability to tolerate pain is variable, so everybody has their own pain threshold and what they can and can't stand. The pain will often go away with mild over-the-counter pain medication, mild exercise, warm baths, warm heating pads, etc. So females do, have some issues with cramping throughout their menstrual cycle. Abnormal cramping often includes mild to severe cramping that begins before bleeding and continues several days after bleeding. Pain that prevents a woman from participating in normal activities, and pain that requires a prescription pain medication monthly. Amenorrhea, which is no period. It's a concern after age 18, And periods, a second concern would be if they stop for 3 months or more. So that's when you need to get a medical professional involved. It could be occurred because of pregnancy, sometimes lack of body fat. Like, I don't know if you've ever seen gymnasts, but they're very small in stature and their bodies appear somewhat juvenile. And a lot of times it's because their body fat is so low that their body is not producing estrogen. And that is causing that adolescent type of body that a lot of gymnasts do carry. Let's see, endometriosis. I'm sure you've heard of that. That's when some of the uterine lining retrogrades, which means the endometrial lining flow through the fallopian tubes, sometimes in the abdominal cavity during a woman's period. This can cause, person to be very uncomfortable. It can cause problems with getting pregnant. It can cause, bladder or bowel issues. So endometriosis can be kind of a severe issue. Some symptoms that a person might experience would be pain before, during, and after period, painful bowel movements, painful intercourse. Is most likely to occur in women who have 28-day menstrual cycles or less. Can cause infertility, like I said before. 1 in 10 women will have endometriosis. The treatment options include hormone medications to prevent ovulation, like an oral contraceptive, pregnancy, laser surgery, and a hysterectomy are all possible treatments. All right, now for just some sanitary things. So when we're talking about menstrual cycle, thoroughly cleaning the reproductive organs, changing pads or tampons frequently to prevent infections, like we talked about, toxic shock syndrome, medical checkups regularly. There is a Pap smear. That's a test. It's a cancer test. They consider it preventative. Or a screening to find out whether you have cervical cancer. Or they will test for breast cancer as well. And most women 40 or above, they do one at 30 though. They do one mammogram at 30 and then usually don't do another one until 40, unless you have a history of breast cancer in your family. Would they encourage you to get a mammogram Okay. So a Pap smear is basically where you're going to have an abdominal exam where they're going to go in with like a Q-tip and they're going to swab the cervix and check to see if cervical cancer is there. And they will do this every time. They usually don't do it until females have their first sexual experience, or I believe it's 2021 that they will want to do a cancer screening. And then typically you do that every year that you go in for your physical. For the breast examination, like I said before, you'll get one at age 30 and then 35. And then if you need to every year thereafter, sometimes insurance won't cover it depending. So you have to check on that. Any questions on that one? Let me see if there's any questions. Okay, let's see. Okay, let me get back into that. Okay. So it is important for you guys to do your self-exams. Like for me, I have breast cancer in my family. I have a grandmother that died of ovarian cancer. And I have 2 aunts that had breast cancer. So it is a concern of mine, cancer in general. But you need to be doing your self-exams each and every month and making sure that there's no breasts in your lumps. Best time to do it would probably be when you're showering. That would be the easiest time. And you just basically put one arm up in the air and then check just to make sure that, you know, you're not feeling anything that's a bump or a lump or anything like that. You do have bumps in your breast though, a lot of times when you are going through your periods. So, but I always, better to be safe than sorry, I always say. So if you are concerned and there's been something there for the last couple months, it's worth, you know, finding out if there's anything that you need to be concerned about. So don't ever be afraid to ask questions or to get questions to your, or get answers to your questions, because your health is, you know, the most important thing. So, all right, so this is where toxic shock syndrome was talking about, just talking about that it can be fatal. Some of the things that a female might experience would be like fever, vomiting, diarrhea, rash, red eyes, dizziness, muscle aches. That would be the onset of, you know, maybe something's not right with me. Maybe I need to, you know, get some help. And then that endometriosis is defined there. It basically occurs when the uterine tissue is found outside of the uterus. So you can understand why that would be somewhat painful and be an issue, you know, for continued pregnancies and things like that. Okay, then we also have ovarian cysts that happen. They're basically fluid-filled sacs on the ovaries. Small cysts may disappear on their own, but large ones may require surgery to be removed. Just a quick little comment here is when I had my first child, I had a cesarean section, and when they were, you know, getting the baby out and stuff, they saw 2 golf cysts around my ovaries, and they took them out and then took them and sent them off to biopsy, and they were clear. But I did not realize, obviously, that I had these cysts on my ovaries. So, you know, a lot of times it can be a hormonal thing. Like during my pregnancy, I developed, you know, extra hormones, which is just common because I'm also developing a child. So those things are not uncommon. So just be aware if you ever are told that you have an ovarian cyst, they'll be concerned about it and they may want to do an ultrasound just to see, but it's not typically a life and death kind of thing that you have to be worried about. Vaginitis is a vaginal infection or inflammation, and symptoms may include discharge, odor, pain, itching, or burning. And then STDs can increase the risk of cervical cancer, uterine cancers, things like that. Okay, so you know, the one that comes to mind is herpes, and there is a vaccine that you can get that can eliminate a large amount of the strands that are out there and prevent you from ever getting it. So that's something that you might need to consider and be asking some questions about. Okay, so how is the baby made? The male sex hormones enter the female via the vagina. The sperm will travel through the vagina, pass through the cervix and into the uterus, and finally into the fallopian tube. If a mature egg is present, one living sperm will enter the egg, creating a zygote, which is a cell that will eventually become a baby. The fertilized egg will travel through the fallopian tube and attach to the uterine wall. The uterine wall will nourish the zygote as it develops and becomes a fetus. The fetus will remain in the uterus for approximately 40 weeks until childbirth begins. And then once we get done talking about this, this is when we will talk about the baby and the development. Okay, so any questions on the female before we go into the male? Because the female to me is really, I mean, it's complex, don't get me wrong, but with all the parts and definitions, it seems to be a lot more simplistic than the male anatomy. But we're going to tackle that next, so we'll see what we think about that. So I'm going to go grab that, and then we'll talk about it. Okay, so this is the male anatomy. All right. All right, so Basically, the reproductive system is a group of organs whose functions is to create sexual reproduction. So look at this as just, this is how we reproduce. So the functions are to produce, maintain, and transport sperm and semen, to discharge sperm within the female reproductive tract during sexual intercourse, and to produce and secrete male sex hormones responsible for maintaining the male system. Okay, so production of sperm. Sperm are the male reproductive cells, and on average, each ejaculation contains 100 to 500 million sperm. However, it takes one sperm to fertilize an egg. So the odds are that there's one egg to 5 million sperm. Odds not so good. Okay, so pregnancy is pretty likely to occur if an egg is present. Okay, so just think of it that way. Sperm contain the DNA of the male and are necessary in the creation of a baby. Okay, so the discharge of sperm into the female reproductive tract takes place during sexual intercourse. Sperm must travel from the vagina to the fallopian tubes. Many of the sperm cells do not maintain life throughout this journey. Okay, so we just talked about that. The vagina is very acidic and it kills a lot of sperm. Okay, and if you think about how it needs to travel, it's got to pass through the mucus cervix, go through the uterus, and get up to the fallopian tubes to then fertilize the egg. So it does have quite a journey that it needs to travel. Okay, so once the reproductive system has begun to mature, usually between 12 and 15 years of age, hormones will be produced to stimulate the production of testosterone. And testosterone is the male sex hormone that causes many changes in the body that signal maturity, such as broader shoulders, muscle development, facial body hair, the voice becomes deep, controls the production of sperm. So these are all kind of like what we call, you know, becoming a man, developing into maturity, things like that. All right, so we're going to look at the diagram for males. So hopefully you can do that with your Google Classroom. So I need to go grab mine because I don't have it. Okay, or do I? No, I don't. Okay, so the male reproduction, we'll pull that up so we have it and you can fill it out as we go. I noticed that some people filled them out via Google, and you might want to change some of the terminology because some of your terminology is pretty complex, which it doesn't need to be like that. You can just keep it real simple. Okay, so I will be identifying as we go through. Okay, so testes, also called testicles, they also produce the hormone testosterone. So if you can kind of see the play on words there, they are very similar, okay? There are two glands that secrete testosterone and they produce sperm. The scrotum is an external skin sac that holds the testicles. And the penis is a tube-shaped organ that extends from the trunk of the body just above the testes, composed of spongy tissue that contains many blood vessels. When blood flow to the penis increases, it becomes enlarged and erect, and this is known as an erection. When the penis becomes erect, it can ejaculate semen from the body. Semen is a thick fluid containing sperm and other body fluids. Okay, so we're going to go identify these parts. I just want to make sure. For the scrotum, I don't know. The scrotum, I just wanted to tell you, keeps the testes either close to the body or away from the body. They're kind of always kind of moving because they need a constant temperature. So if, let's say a male just got out of a hot shower or what have you, the scrotum will hold the testes further away from the body because the body's too hot. Or if they went into a cold pool or something like that, the testes or the scrotum would hold the testes close to the body because it's lacking heat. And so that does happen. It can also, you know, if a male became frightened, they can shrink up. The scrotum can, you know, hold the testes closer to the body for temperature regulation. So it has kind of an important job. All right, so let's go and fill out our diagram here for testicles, penis, scrotum. Okay, so obviously number 11 is the penis. And number 1 is the scrotum. And then number 2 is the testes. Oops. Testes. Okay. All right, so all boy babies are born with foreskin. And basically it's a covering of the penis. And it's referred to as foreskin. When a child is circumcised, that means that they're going to cut that foreskin away, and that would be a circumcision. All boys in hospitals will be circumcised the day they're born. One of the reasons they do this is for proper hygiene, because it's important. Sometimes if a man was not circumcised and he did not clean very well, there's something called smegma that can build up, and it's basically oils and bacteria that the body secretes naturally, but this is a buildup because the body is not being cleaned properly. Sometimes it's done for cultural, religious reasons. There is no biological need to circumcise, however. Recent studies show that the foreskin is more porous than other tissue on the penis, allowing viruses and bacteria to enter the foreskin itself, which is going to increase the risk of STI transmission. But, you know, there's, you know, some people might refer to it as body dysmorphia because you're changing the look of the body that was naturally with foreskin. But like I said, in a lot of societies, they look at it as it's a, you know, keeps it cleaner, easier to, you know, hygienically keep it clean. And so that's one of the reasons that it's done. But, you know, there's no specific medical reason to have it done. So when you become a parent and have a child, you will have to make that decision whether that child is going to be circumcised or not. So just wanted you to be aware of that. And I'm trying to check to see if there's any questions, but I don't see any. So I'm going to continue on. I'm going to show you a picture of circumcision so that you have an idea of what it looks like. Okay. Here we go. All right. So you'll see on the left-hand side the foreskin and how it kind of comes up and over the penis. And then when somebody gets circumcised, they kind of cut away that extra skin, and then it kind of gets rolled back and stitched. And then, you know, they will use some type of anesthetic to kind of numb the area so that it's not hurting or harming the child. But again, that's up to interpretation. Some people would say that looks painful, or, you know, so. All right. So sperm requires a range of normal body temperatures in order to survive. So like we were just talking about. So if the sperm is too cold, the muscles surrounding the scrotum will cause it to move closer to the body, therefore increasing the temperature. If the sperm is too hot, the muscles surrounding the scrotum will relax, allowing the testicles to move further away from the body. All right, now we're going to talk about the internal organs. Yes. Does someone have a question for me? I thought somebody was there. Nobody had a question? All right. Well, if you do, don't hesitate. All right. So these are the internal organs. So we have the vas deferens, urethra, seminal vesicle, prostate gland, Cowper's gland. Okay. All right. So they're showing you the identify. I'm going to go and identify those for you, and then we'll define them in the next couple slides here. So let's go back and look at those. I gotta. All right. Okay. So here we go. All right. So number 4 is the tube that starts at the testicles and comes all the way up and around. Okay. And that is called, I want to make sure I label the right one. That is called the vas deferens. I always spell this one wrong. There we go. No, I didn't get that right. There we go. Sorry. Okay. And then number 5 is the Cowper's gland. Okay, and then number 9 is the prostate gland. I put that, okay, I did. And then I'm trying to think whatever else they told us that we would have to find. Okay, the urethra is number 10. Now remember, urethra is different than uterus. The urethra is in the male and female connected to the bladder. The uterus is in the female where the uterus is. So in the female body. All right. I think I've labeled everything that we're going to talk about thus far. So, oh, there is one I forgot. Number 7. 7 is the seminal vesicle. Seminal vesicle. All right, so let's go learn about these. This isn't responding. There we go. Okay. All right, so testes, also known as testicles, are divided into hundreds of tiny tubules in which sperm are formed. Let's see. Sperm is produced within these tightly coiled tubules. They're 700 feet long when uncoiled. Sperm is produced at a rate of 100 million a day. Like we talked about before, temperature and sperm production are related. Sperm production can be also affected by illness, drug use, poor nutrition, and stress can all reduce sperm count. And it does take sperm 90 days to complete production. Male testicles need to be examined after puberty for testicular cancer. This needs to be done by a clinician once a year and a self-exam monthly. Males between the ages of 15 and 35 are at highest risk. So that is a age group that is in your realm at this point in time. So just keep that in mind as you get older. The epididymis, I'll go back and show you where that is, but the epididymis is a large tube that connects with the testicles. This is where sperm is stored and allowed to mature. It kind of looks like a C-shaped structure when I show it to you. And it's a holding area for sperm to continue to mature. And it takes 90 days. So I'm just going to quickly click back to our identify so that you can see what you need to write down there. And that was number 3. So that was the epididymis. Epididymis. All right. Okay, then we have the vas deferens. And remember, that is the long tube. If you think about it, what would be similar to the vas deferens that the female has? You guys know, the vas deferens is a tube that carries the sperm. What in the female carries the egg? Hello? What in the female body carries the egg? Are you all alive out here in this world? Hello?
The fertilizer tube.
The what? You were so fast. What'd you say? I think it was Azaria. What did you say? Did you say the fallopian tube?
Just it wasn't me.
Oh, okay.
The fertilizer.
The fallopian tube.
Oh.
Okay. So the vas deferens is the similarity with the female would be the fallopian tube, but in the male it's called the vas deferens, and that is what carries the sperm. All right. So the seminal vesicle. Now, if you look at it, and it's really kind of hard to see. I wonder if this view would look at it better. Okay. So you can kind of see the seminal vesicle there. It's like it's right here. And when like in older diagrams that I have, it's even more easier to see it, but this is how I remember that one. I remember it because, do you guys know who the Simpsons are? Can someone verify that you know who the Simpsons are? Anybody?
I do.
You do. Okay. So if you know the Simpsons, Marge Simpson's hair kind of reminds me of the seminal vesicle. And that helps me remember the S for seminal vesicle, because I'll look at the picture and I'll be like, oh yeah, that's a seminal vesicle. But then I had trouble remembering the definition. So I remember that Marge Simpson's a mother who nourishes her children. And so this is a vessel that has a nourishing fluid that nourishes the sperm. And so that helps me remember what the seminal vesicle is and where it's located, because I remember that little trick. But, you know, if it helps you, great. But just remember, it looks like Marge Simpson's hair, who's a mother, and she nourishes her children, which is this nourishes the sperm. So that's important to know. So seminal vesicle. Prostate and Cowper's gland. There are two glands that secrete a fluid that mix with the sperm to create the semen. Secretion of the fluid will not only mix with the sperm, but will precede the sperm to lubricate the urethra prior to ejaculation. Again, the urethra is shared with the reproductive system in the male anatomy, and it is acidic. And so this Cowper's fluid that precedes the semen, that lubricates the urethra, so it's not killing sperm on its way out. Okay, so that's important to know about the prostate and Cowper's gland. The prostate, I don't know, the prostate as a protective fluid, to the sperm. And then the Cowper's gland is the one that releases the lubricant that's going to come first before the actual sperm itself. All right, let me just do urethra and then we'll call it a day. So the urethra is the tube that leads from the bladder through the penis and carries both semen and urine to the outside of the body, but never at the same time. It has happened where men, what's called like a retrograde, where sometimes the semen will come up into the bladder, and if it happens once, it's not a big deal, but if it keeps happening, it can be concerning. So, just be aware of that. It doesn't happen a lot, but if it does happen more than once, it'd probably be something that needs to get checked out, just to be on the safe side. Let me double check. Okay. Okay, any other questions as of right now? Let me check my chit chat here. Okay, let me finish filling this out for you guys. Number 6 is the rectum. And that would be the only one that we haven't identified. Oh, number 8. Okay, number 8. What is number 8? Oh, number 8's the bladder. Okay, so I think we've cleared this all up, so you should be able to turn that in today. I think I moved the deadline back till tomorrow just to, make sure everyone got an opportunity to turn it in. But that would be the only thing I'm collecting at this point in time. So just make sure that you filled that out with us, that you got it in. And then the next time we come together, we'll start talking about going over some of the terms that we just went over, and then just recapping a little bit, and then starting in on fetal development. So any questions that I can clear up for now, or that, you need an answer to before you leave? All right, well then I am all set. And we'll just talk to you Wednesday. If you do need to take the test, come to office hours. I have them on Tuesday from 11 to 12, Thursday from 2 to 3, and Friday from 11 to noon. So, yep.
See you later.
Bye, Dustin.
See ya.
Bye, Tanner. Michael, are you in the house? Caden Hempstead, are you in the house?
Yeah, I'm here.
Okay, just checking.
I was paying attention.
All right, we'll talk to you later.
Yeah, okay, bye.
All right, bye.